What I'm going to do through this presentation is to take you through some changes that are happening at the NMC as an organisation, and then an update on the work of the midwifery team and linked pieces of work in professional practice. So we've got a new CEO and registrar. This is Paul Rees, who is joining the NMC at a time when we're dealing with the new direction of the organisation following an independent culture review. And it's worth saying that the independent culture review followed reports mainly in the Independent over a time highlighting problems in the workplace at the NMC. And this included things like racism and bullying. And some staff were absolutely very unhappy with their place of work. So the NMC asked Rise Associates to do an independent culture review of the NMC. And it is worth noting that they found good things as well. There were lots of staff who felt supported, who had good managers that they felt they could talk to, and that they knew what to do and how to tell someone about it if they saw bad behaviour. But Paul's strength in coming to the NMC as the CEO and registrar is that he has experience of leading organisations through culture change, and transformation is going to be a crucial part of the NMC's work going forward. So along with Paul, we also have a new chair of council, and Ron Barclay-Smith takes over from Sir David Warren, who served his full term of 4 years at the NMC. And you can see from the date that Ron Barclay-Smith is just in post. He sort of came in on the 1st of April, and he's going to lead the council in the strategic direction so that we're realising our vision of safe, effective and kind nursing and midwifery practice. And he's going to be implementing the corporate plan for 2025-26 and beyond. So just to summarise on that point, the Independent Culture Review was published through Rise Associates in July 24, and they had done, as you would expect, they had interviewed, they'd talked to people, they'd surveyed, they'd gone around the organisation, they'd looked at all sorts of the processes, particularly around fitness to practice, and they've set a plan in motion to deliver new and significant culture plan based on the insights that came out of that independent culture review. And we as a midwifery team are committed to supporting that work. And for those of you with access to the slides, you can see the culture transformation plan on the link. So given that we're in Dublin, just a little reminder about the NMC, because of course the organisation that regulates in the south of Ireland is the NNBI, but the NMC, the regulator for the UK, was established under the Nursing and Midwifery Order in April 2001, and it sets out the primary function to protect the public. And it also sets out some elements that are specific, for example, to midwives only, which is the protected function, and also identifies the protected titles for those that are on the register. And our role is to regulate, to support, and to influence. And under the regulation side of our role, we're thinking about and doing the setting of professional standards, quality assuring the education programmes, protecting the integrity of the register through the FTP processes, and then the support is around the guidance and resources that we provide for professionals, working with employers. And in that space, we have a team within our directorate who are called the Employer Link Service, and they work regularly with the employers. So they're regularly talking to directors of nursing and chief midwives in organisations to help them to manage issues locally before there's any referral to the NMC. So it's about addressing issues at base, really, so that the NMC is not the first point of referral. And they're also there to offer, and we offer, advice and support, but they're particularly, we're in the space of offering advice and support to professionals going through the FDP process, and we have support mechanisms in place now in a way that we didn't have a couple of years ago. And then in the influencing space, there's a lot of engagement with senior stakeholders across the UK, and in recent years, within the last 5, we've developed a research team, and they are doing the sort of insights into both our data and doing the work that helps us to share insight about the professionals on our register. So we have 6 monthly reports about the sort of state of the register and so on, and that work is coming through and is regularly now shared with us and developed through the use of our research team, which is great. And we're using our voice to advocate for a healthy and inclusive working environment in the sort of, as you say, that engagement with senior stakeholders. And just some elements around how we regulate in the various points. So in the sense of keeping the register, there's the parts of the register, and then we have the linked standards of proficiency for those entering the register, and the protected title and the protected function that I've already mentioned. And it's worth noting that midwife is a protected title, along with registered nurse and nursing associate, but we have a specific protected function that applies just to midwives. So that's where Article 44 and 45 come in. And in the education and training, it's the setting of standards, and that comes in with all the standards, which I'll show you on the next slide, of which there are a plethora. So the other point that we talked about is the quality assurance and the approval of AEIs and the courses that they provide, and the qualifications at the end of it. But it's worth saying that the standards of proficiency for the various elements of the register are what forms the basis of the curriculum across the whole of the United Kingdom. So every midwife is taught on a pre-reg programme with a curriculum that's based on the standards of proficiency for midwives. And we also have a revalidation process which is around remaining registered, and that is where registrants, as they follow their career and stay registered with the NMC on a regular basis every 3 years, show evidence of their CPD and the learning that they've done and the reflection, and think about their CPD and continuing professional development needs going forward. And again, we would suggest that they consider that in the terms of the standards of proficiency. So the plethora that I mentioned, this is a pictorial sort of reminder of the code being absolutely at the centre of everything. It underpins all of them, but we have, as you can see, with the Standards for Education and Training, Part 1, which is the standards framework for education, so that's the sort of structure across the AEIs and so on. And we have the Part 2, which is the standards for students, supervision and assessment, and then we have the programme standards for pre-reg and post-reg, which are Part 3. We also have the standards of proficiency, and those cover everything from standards of proficiency for midwives through to prescribing and return to practice. So there's a plethora, again, of standards of proficiency. So you may recognise somebody. The glasses are sort of the key identifier in my case. But we now have a midwifery team at the NMC, which is an absolute delight because we've sort of grown quietly, sort of underneath the radar over the last 5 years, really. But Jackie and I came in during the development of the standards of proficiency, And that wasn't, that had quite a long gestation in terms of the development of the standards, because it wasn't just that we suddenly sat down in 2018 and thought, oh dear, yes, we'd better publish some standards. There had been a long run-in with a thought leadership group headed up by Mary Renfrew, who coordinated the collating of the evidence, the gathering of the evidence on a global as well as a UK-wide point of view around the evidence around what was best practice in midwifery and what we needed to have in the standards. And that process took about 2.5 years in the run-up, and we had to get approval from council and so on, and we had critical readers and the whole sort of run-up to producing a modern set of standards fit for the future. And Jackie and I came in with Jackie adding her expertise as a former lead midwife for education, and me adding expertise from the one side of the table to the other. I have been told that I've moved from poacher to gamekeeper, but I had come in originally being on the thought leadership group and then found myself on the other side of the table actually helping to bring them to the state of publication. And between us, Tracy's come in 2024, leading the team as the AD, and between all of us, we're bringing midwifery experience to the NMC from hospital, from community, including midwifery-led units, home births. We've experience of free births between us, management, leadership, governance, quality assurance, education, policy, confidential inquiries, which Patricia and I were involved with setting up many years ago, expert witness work, statutory and clinical supervision, and system regulation. And so we've now got, I think, most of the bases covered from the midwifery front. So we're on a mission, and part of our mission has been the development under Tracy's guidance of a midwifery work plan. And we've done this with our strategy and insight colleagues, so across one of the other directorates, which I think is a good example of cross-directorate collaborative working within the organisation itself. We've presented to Council in May 2024, and they are very interested in midwifery, because at one point there was regular reporting of midwifery matters to NMC Council, but with the end of statutory supervision and the removal of midwifery from statute in that sense, that reporting mechanism stopped. So this is a revival, in a way, of the reporting to Council so that they know what's going on from the midwifery point of view within the NMC. We've a live comprehensive midwifery activity document, and we update that quarterly, and we have 8 work streams. And I'll not read all of the work streams, but it's just to say that we're covering from principles to support women's choice and multidisciplinary team working, and thinking about embedding the midwifery standards of proficiency. The test of competence is something that we're going to be moving forward to look at, and also thinking about education and quality assurance. So this is going to keep us busy and occupied. And I would just draw your attention to 1 or 2 of these particular work streams. There's a lot of engagement with midwives, and that is part of, for example, the speaking engagements like today. There are training sessions, webinars, conferences and festivals where we discuss our standards and talk about the supporting of their implementation. And we have the collaboration with key stakeholders. And this is an interesting one, because we're in the process of moving towards publication of a document that we've been working on a while, which has changed titles along the way. At one point it was Principles for Personalised Choice, for Personalised Care, and it's now Principles for Supporting Women's Choices. And this work is based on an issue which then sort of morphed a bit. And the underlying thing was a reported increase in requests for free birth and care from unregulated people in the UK. And from that, we've collaborated. We've done some quantitative data collection, because it wasn't clear how the data around free births was being recorded, if at all. So we're in a better place, having done this work, to know sort of where we are, even if there's work to be done from the data collection side on this. And as I say, the document is around supporting women's choices. And as always, based on the code. We're looking at a review of the code and revalidation. And this is going to include within it what this means for advanced midwifery practice. And I would say that at the start of this piece of work, we drew heavily on the work of the NNBI around advanced midwifery practice and the regulation thereof, because it wasn't, we were not in a place where we had ever set standards for advanced practice, nor had we regulated advanced midwifery practice. We've got some ongoing work with the Practice Learning Review, which I'll come on to, and around medicines management. We have a system in the UK of midwives' exemptions, which allows midwives to supply and administer medicines that are on the general sales list and the pharmacy list, and then a specific list of prescription-only medicines which are in the medicines regulations 2012. But it's something that has been, I think, become slightly blurry because of the onset or the production of PGDs and the midwife prescribers coming into the picture, which is all good, but we need to be in the space for those midwives' exemptions being updated, because it is the way that many midwives provide the medicines that women need through their pregnancy journey. We're thinking obviously about education quality assurance work, and although we're not in the EU, and we'll move swiftly on that, we do always want to keep an eye on what the EU are doing, because we absolutely don't want to end up in the position where we are dramatically different. So we're thankful to our friends who are still within the EU network that keep us up to date and informed about what's going on, and we've been able to sort of be in the room when the changes to the EU directive are being discussed, which is great, because that's a very important part of us in the sense of particularly the cross-border work with Northern Ireland, but also the fact that many midwives go backwards and forwards over their lifetime career in both directions. We're looking at the use of AI and technological advancements, and I suppose some of the ways that this has come in are around the use of the sort of learning techniques that were never available to most of us as a generation, and that it sort of links into the video learning capacity and the sort of, learning suites where it's possible to set up scenarios and practice before you're in that sort of situation. But that does vary depending on the university or the AEI setting and what they have access to. We are in the process of working with our comms colleagues on a public campaign to relaunch, in a way, the role of the midwife and the importance of the midwife in the as Mary was talking about this morning, in the sort of global sense, and also in the sense of the importance of the midwife's role for the future of both the woman, the baby, and the family as they go through life's course. We also are involved with supporting national reviews and inquiries, and it was a privilege for me to be involved with the inquiry that Mary Renfrew did in Northern Ireland, and also to take part in the action planning and so on that's going on as part of the follow-through with that. And I would say that Tracy's also been involved with linking in with... Tracy's in the audience, by the way. Tracy's also been linking in with the inquiry side of things in the UK. So again, we're wanting to be sort of ahead of the curve on that. And what we've done with each of the inquiries as they've come out is to map them against our standards of proficiency. And we have been delighted to say that they're not identifying large gaps with our standards of proficiency, which is a real plus. And I suppose the one thing to say is that we're championing and continue to champion midwifery across all the NMC directorates. And we have had cycles of going around the directorates to say, just to let you know, there's a whole load of midwives here. So if you want to know anything about midwifery, do get in touch. So talking about some of the statistics and the insights and spotlights, this is just a little snapshot of a breakdown of midwives across the UK. And this was in our 2024 report. So there'll be more coming up throughout this year. But it's always interesting to look at the sort of change in numbers. But I suppose the sort of rider for this would be, this is not the same thing as whole-time equivalents. So it may look like we've got loads and loads of midwives more, or lots and lots of more. I mean, there's quite a difference between 2018 and 2024 on the English midwives side, going from 29,000 to 36. But as I say, that needs to be remembered in the context of it's not whole-time equivalents, and there have been the context changes in the sense of demographics and acuity that mean that this is not necessarily a completely whoopie-doo picture, because you have to think of it in the context of the care that they're giving. And it's the couple of other points from this. We have a 2.4% increase, and around 30% of all registrants are from Black and minority ethnic backgrounds. There's been an increase in the number of midwives trained outside the UK, and I would think that may well be a reflection as well in with the NNBI figures. And midwives make up 5% roughly of the entire register. And the register is now hitting well over 750,000. So that's quite a lot of people, and it's a rather large number and getting bigger. So interesting. But those reports, as I say, do come out regularly on a sort of 6 monthly, and then there'll be an annual report. So worth keeping an eye on our website if you're interested in the statistics side of it. So what we've been doing from the midwifery point of view is we've been looking at our standards for midwives. And I talked earlier about part of the work around implementing the standards, and it was mentioned this morning about the sort of following up and seeing how the implementation had worked. We've done the mapping document looking at, as I said, previous reports, Kirkup and Ockington, mapping them against our standards. And we sent that out to DOMs and HOMs because we were trying to pick up on what was mentioned around embedding the standards in practice. And that's a much more difficult thing to do than to embed them in education, because education embraced the standards. They were really involved with the development. They have inevitably worked with them because they've based their curriculum on the standards of proficiency. So it's knitted into the education and to the education of midwives. And the midwives educated to these standards of proficiencies are now coming out the other end of that process, but they're not necessarily finding that practice is prepared to have the environment ready for them that allows them to practice as the proficiencies would like them to. And we've made some changes to our standards for pre-reg programmes, and we've realigned the language which had been changed to facilitate the birth to conduct, because facilitate is a word that's used by other people in the birth space, and there's that element that's linked to the protected function, which is really about the midwife and the conducting of the birth. So we're continuing work. We've analysed the feedback from the heads of midwifery and the directors of midwifery, and we've got work to do, shall we say, around getting that into practice, getting the standards into practice. And we also have a responsibility to keep our standards under review as new evidence emerges. And thinking of the test of competence, again, our test of competence which is the way that midwives trained outside the UK, apart from the EU, trained outside the UK, get onto our register. And again, the test of competence, the OSCEs and the CBT, drawn and based on the standards of proficiency. So that's a little work in progress. And we're also, as I said, keeping an eye on the new EU directive. We are considerate of the WHO policy around ethical recruitment and work with our colleagues in NHS England on that one. And then we're, as I say, keeping abreast of the maternity service and the midwifery reviews in the UK. The work that we're doing around internationally educated midwives is working on a better understanding and strengthening of the experience of internationally educated midwives, and key work streams around research projects, which are, as mentioned, overseen by our research and evidence team, and education and standards, and then thinking about how we can strengthen the test of competence guidance and looking at the monitoring pass and fail rates and thinking about self-assessment prior to anybody putting themselves through the test of competence process. And then we've got various other projects around policy work, stakeholder engagement, and other relevant areas. So I mentioned this Principles for Supporting Women's Choice, which is the title that we're currently using with this final draft document. We had meetings over last summer to discuss the way forward around the concerns around free birth and the related issues, and that came into care outside guidance, the links with the ambulance service, because the ambulance service feedback was that they were being used as a sort of default birth service, and that absolutely isn't their role. They're an emergency service, of which emergency midwifery or obstetric care is a very small part. So there's some balancing up that needs to happen there. And then issues around the notification of birth after a free birth, which is and has proved to be quite tricky. So we're working with NHS England and again with digital midwives to make sure that there's a clear process around the notification of birth, which, as we're all aware, is not the same as the registration of birth, but it often gets confused. So our 3 task and finish groups worked over the summer, and we would say that we have produced this document collaboratively and co-produced it. And it's been a multi-agency and an interdisciplinary piece of work, because we've had, for example, representatives from the RCOG. We've discussed the issues with the police, and again, thanks to Tracy, we managed to find the probably 3 police people who are actually midwives when they're not being police people. So that was very helpful. And absolutely very important to have their contribution to this work as we move forward. We're hoping to publish, it'll be late spring, because as you know, these timelines always slip a wee bit. So that's where we're at with that. But I think that's one that's sort of, in a way, awaited, because it's something that's been growing and has perhaps been sort of accelerated by the whole COVID process and the restrictions to both care options and visitors that came in as part of the whole COVID process. So, thinking about advanced practice, our register at the current time doesn't identify anybody practicing in advanced practice roles, and we don't set standards and we don't approve the programs. So this is a piece of work that there's variation across the employment settings, educational preparation varies, and all the 4 countries were very clear about the need to grow the AP workforce, and they all have frameworks in place. And for example, the Royal College of Midwives has a position statement on advanced practice, but no standardised or agreed definition of advanced practice in the UK, which was something that we looked at. And after a lot of scoping and so on, we've got the agreement from Council that additional regulation of advanced practice is needed for both nursing and midwifery, and we can now proceed to phase 2 of the review. So what we're going to do is develop standards of proficiency in time and adopt a collaborative approach and think about the requirements to be included in the review of revalidation, which is also something. Our timelines have been revisited, and while this is a complex piece of work, it will take time. And just there's information about joining the community of interest and keeping an eye on what's going on in that space. We've also done some work on the practice learning review, and again, if anybody's interested in this, this is around the practice learning environment for students and how we can best support that sort of going forward, because we're hearing a sort of mixed bag of feedback from students around their practice learning environment. So again, if anybody's interested, we do have a community of interest and we'll be moving forward with that piece of work. We've done studies and we have Council permission to look at key lines of inquiry, which are around practice learning experiences of students with protected characteristics, supporting students in practice, developing quality indicators and metrics, evaluating key aspects of the midwifery curricula to understand the student practice learning experiences, and that's code for looking at the numbers, so looking at things that we have in our curricula that you're all familiar with because it's the language of the EU directive around numbers of births. So that's what that is looking at, and then evaluating, this is a nursing one, that support nursing student attainment for their intended field of nursing, and that's because we have 4 fields of nursing in the UK. So that's about looking at that and their relationship to existing education standards. So that's been a bit of a whistle-stop tour, but I think I finished on time. So extra brownie points for that. And thank you all for listening, and I hope that has been an update that has been of interest to you about the work of the NMC. Thank you very much.
Thank you, Verena. And it's fascinating to hear the NMC perspective, because I'm usually embedded with the NMBI and the sort of crossover of many of those issues. I have about 50 questions, but I won't burden you with those questions. No, thank you. Was there any questions from the audience? We could probably take one.
Have I stunned you all into silence?
I just wanted to ask something. The nursing associate, what does that title mean? Is that like the old SEN, or is it a different role?
I think I'd probably be taken off stage and given a good thumping if I said it was the old SEN.
Sorry, it's just I wasn't familiar with the term.
Yes, but I understand where you're coming from. It's a new role that came into being about 2019, and the point of the nursing associate is they do a foundation degree, which is around 2 years, and they're there to support the nursing profession.
Okay.
So many of them will go on to do a sort of further education and then do their nursing. So it's in a way a step method to get to the nursing degree. And many of the first people to go through the nursing associate foundation degree were healthcare assistants who were already working in the system. Okay. So that's where that roles come from. But I would stress that in the UK, nursing associates currently are only in England, because the chief nursing officers in the Celtic countries, so Scotland, Wales and Northern Ireland, didn't want nursing associates at the time it was being discussed. And the other thing was that midwifery was very clear from across the UK that they did not want a role like that for midwifery associates. So it's purely in England, and it's a support for nursing.
Okay.
So,
Thank you very much.
thank you.
Thank you, Verena.